Is now starting. All attendees are in listen-only mode.
Hi, good morning, everybody. Welcome to this morning's National Disability Employment Awareness Month webinar. My name is Stacy Jones, and I'm the Employment Services Coordinator with the Developmental Disabilities Administration. We are very thrilled to have you with us today. Before we get started with the webinar, I want to talk just for a second about the webinar platform. All of the participants that are listening in today are in listen-only mode. If you have trouble with your audio throughout the presentation, you may want to consider switching your audio, either try it through your telephone, or if you're calling in, try through your computer and see if that helps with any trouble you might be having. Today's slides that we're going to be sharing are actually available in the handout section of your control panel on the right-hand side of your screen. So you're welcome to download the slides so that you have them. And we will also be emailing the presentation out to everyone that is registered for today's webinar. We are recording today's webinar, so we often get a lot of questions about that. And we will make sure that once it is uploaded to the DDA website that we make people aware of that. So you're welcome to view it again or share with other people. If you have questions throughout today's presentation, you're welcome to type your questions directly in the chat box, which again is on the right-hand side in your panel, and we will have staff that are going to be monitoring the questions throughout to see that we can get to anybody's questions as appropriate. I'm going to turn my camera off now and give you a little update on what we can expect today. So up on the screen, you'll see our agenda. We have a lot of terrific presenters today, and I'm going to share quickly what are some of the topics we're going to touch on. First, we'll be recognizing the Governor's Proclamation about National Disability Employment Awareness Month and hearing some opening remarks. Then we're going to hear some success stories of essential workers that have been working during COVID, and how the use of remote supports and technology has been critical during this time. And I want to point out also on the agenda that we will be taking 1 or 2 minutes for a short stretch break in the middle of this 2-hour scheduled webinar, somewhere around the 1-hour mark. And then when we come back together, we're going to talk about some employment data trends and then hear about the phase out of sub-minimum wage in Maryland. And I now have the pleasure of introducing Secretary Carol Beatty of the Maryland Department of Disability, who's joining us this morning to help kick things off.
Thank you, Stacy. Thanks for the opportunity to spend a moment or two with you at the beginning of this very exciting webinar. As Stacy said, I'm Carol Beatty. I'm the Secretary of the Maryland Department of Disabilities. I'm happy to be here today to celebrate National Disability Employment Awareness Month. And I'm so glad that we have the proclamation right here, so I don't have to do a show and tell from home. So I bring you greetings and warmest best wishes from Governor Larry Hogan, Lieutenant Governor Boyd Rutherford, and the entire Hogan-Rutherford administration and your friends at the Maryland Department of Disabilities. And I also want to thank the organizers of today's events because I know how hard it is to handle the logistics, especially now, and to bring everybody together. And I'm so pleased to see that this event continues even during the pandemic, because the work that everyone is doing right now especially deserves recognition. As we know, full and meaningful employment for all Marylanders, including those with disabilities, is a top priority of the Hogan-Rutherford administration. A Maryland that is truly open for business means that all citizens must have the opportunity to work, including those with significant barriers. So as we focus on the reopening of our state and businesses during this pandemic, everyone must be included in the recovery planning. Financial well-being is one of the 4 goals of our state's disabilities plan. And so at a statewide level, we join forces with our sister agencies, including the Developmental Disabilities Administration, the Department of Labor, the Maryland State Department of Education, the Division of Rehabilitation Services, Health Department, Commerce, All of this is to strengthen employment initiatives like apprenticeships, training, and capacity building for workforce development providers, and creating opportunities and strategies for business engagement. 4 years ago, Governor Hogan signed the Ken Capone Equal Employment Act, phasing out 14C certificates for the use of subminimum wage jobs for people with disabilities. And I know you're going to be hearing more about that from the famous Ken Capone and others that helped do the work on that. I am happy to report that Maryland is at the end of the phase out of subminimum wage. When we began 4 years ago, there were 41 agencies in Maryland who paid their workers with disabilities under this exemption. In Maryland, as of October 1st, 2020, all individuals with disabilities are now being paid minimum wage or higher. The work on the 14C issue underscores that what we all know, that no one group can do this work alone. We must all come together to address concerns and identify opportunities. The Maryland disability community has made the commitment, and employment for all Marylanders, including those with disabilities, is a top priority of the Hogan-Rutherford administration. Governor Hogan has proclaimed that every October be Disability Employment Awareness Month in Maryland, and you can see the proclamation on to the right, I think that's the right, of the screen. And I'd just like to read a portion of it because it's so small, I'm sure you can't see it. So it says, from the Governor of the State of Maryland, Disability Employment Awareness Month, October 2020. And it says, whereas Disability Employment Awareness Month is an opportunity to recognize the contributions of people with disabilities, and through national and local campaigns, create greater awareness of the talents and skills individuals with disabilities bring to their employers. And whereas we believe in Maryland, which recognizes the unlimited potential for all of our citizens, including those with disabilities, to live, work, and thrive in our communities. Whereas we recognize the contributions of essential employees with disabilities who continued to serve our communities during the pandemic. And whereas we are committed to the principle that business profits by investing in workers with disabilities, Maryland will continue to strive to expand employment opportunities for Marylanders with disabilities and consider work the first option for working age adults with disabilities, thereby giving every Marylander a chance to contribute to the state's economic life and reap the rewards of this contribution. And it is signed by our Governor, Lawrence J. Hogan Jr., our Lieutenant Governor, Boyd Rutherford, and our Secretary of State, John Woburn Smith. So again, thank you for Stacy and the leadership at DDA for having me here today, and also for your commitment to the collective work as partners to ensure that competitive integrated employment is a reality here in Maryland. Thanks so much.
Thank you, Secretary Beatty. We appreciate that. I would now like to introduce Deputy Secretary Bernie Simons of DDA for some additional opening remarks.
Thank you, Stacy, and thank you, Secretary Beatty. I want to thank everybody who's on this webinar today for joining us to celebrate the National Disability Employment Awareness Month. This year's theme is increasing access and opportunity. And, you know, I think we all recognize since March, going into the public health crisis that we had, that we need to figure out how to get much more flexible in the models for employment, to do remote, assistive technology. And many of you, if you've been on our website and looking at the page we have for Appendix K that we submitted to the Center for Medicare and Medicaid Services to allow more flexibility, since people were not necessarily working but could do some type of employment activities, could do this remotely as opposed to in person. And so things look a lot different, but we still think it's critical because, you know, if you again look at our website, you'll see that employment first is one of our 5 pillars, including supporting family self-advocacy, self-direction, etc. And so we think that employment first is extremely important for individuals to be able to either self-sustain or self-actualize themselves. And we also want to recognize the providers who support individuals, and we'll be doing that by highlighting some stories. Again, as Secretary Beatty just said, I think we all recognize that this was a great opportunity with the Ken Capone bill, and as Secretary Beatty said, you'll be hearing from Ken later, but going from 41 agencies in 2016 to 0 is a major accomplishment for any state, and I think it shows the leadership that Maryland has around the country in doing this. So where are we right now? As I said, we had Appendix K. We had a lot of lessons learned with that, and we do have out that was up from September 1 to September 30th, Appendix 3, in order to make changes to our home and community-based waivers. And there were a lot of lessons learned about employment in integration and assistive technology and doing things remotely, et cetera. And so all of those things people have commented on. People have commented about. This was unfortunate due to a public health crisis, but there were some lessons learned, things that we probably would not have experienced if we did not have this crisis about working remotely, et cetera, and using a lot of assistive technology. So we know that this is going to be here for a while, and it's going to be a lasting impact on employment. But I just want to thank all of our stakeholders and all of our partners in supporting this important initiative in the great state of Maryland. Thank you.
Thank you, Bernie. So I want to start off by just taking a moment to look at this picture, because I think for many of us, it represents how things felt. Starting somewhere around March of this year, we collectively found ourselves experiencing businesses and communities basically shutting down. However, we were and still are. We know that many people are continuing to work day to day. And so we want to start by recognizing and saying thank you to the people that have continued working as essential workers during this unprecedented time. This includes not only people with disabilities who continue to work, but their support staff, their job coaches, families, coordinators of community services, provider agencies, and employers across the state, all at the same time while they're navigating all the uncertainties that came along with this public health crisis. So a huge thank you. We recognize that it's been a very difficult and challenging time for many people, but we also want to take some time to celebrate the good things that have happened. So I am going to, we're going to be highlighting a few of the many, many stories. And we're joined this morning by Kathleen Walker. She's our Employment and Family Lead with DDA's Eastern Shore Regional Office. And we're also pleased to have Stacy Herman, who is the Director of Post-Secondary Services at Kennedy Krieger. I'd also like to note that Stacy also serves as the chair of Maryland's APSE chapter, something that she will touch on a little bit later in today's presentation. So Kathleen, I'm going to turn things over to you.
Thank you, Stacy. Hello, everyone. And just to echo Stacy's remarks, in any event, we are proud to highlight workers with disabilities in our community. But during an international pandemic, we especially want to take the time to share the stories of essential frontline workers. The following personal stories inspire us to continue striving forward to support employment for all. And I'll begin by highlighting Danielle Stallings. Danielle Stallings is an essential worker at Trinity Sterile Sealing Medical Supplies for sterilization. Her employer reports that she is extremely dependable and reliable. Danielle counts medical supplies and heat seals them to protect sterilization. Danielle's proud to work for her employer that respects her abilities for hard work and hard work ethic. Danielle has been dedicated to continue working during the COVID-19 pandemic and follows all of the CDC recommended safety protocols. Danielle's employment provides her opportunity as well as professional growth and purpose to support the community's essential healthcare workers during the COVID-19 crisis. She is supported in her employment by Kristen Bennett, employment specialist with Lower Shore Enterprises, and we thank her for her essential work. Now I'll turn things over to Stacy. Next slide, please.
Good morning, everyone. I'm really happy to be here and to be able to share these stories along with Kathleen celebrating essential workers. We thank everyone for all their hard work during the pandemic. Athaley is a patient transporter at the University of Maryland Medical Center. He is a full-time essential employee. Athaley has been employed during the entire pandemic. It has been extremely busy at the hospital. However, this has not stopped him from going above and beyond for the patients. The hospital's restrictions and new rules have caused some anxiety. However, with his support team being just a FaceTime away, Athaley has been and continues to get over the humps. Next slide, please.
Next, we're going to talk and highlight Oscar Martinez. Oscar works at Petco as a sales associate. He remarks, I stock and sort the items and check the numbers on the items to make sure they are going to the correct spot. I help customers find different kinds of food for their cats and dogs. I keep the store organized and replace items on the shelves with stock from the back when we run out. During the COVID-19 pandemic, Oscar focused on staying safe at home and at work. During the summer, he remarks, I was furloughed for 2 months and I came back to work in June. When I'm at work, I wear my mask, my gloves, so I can stay safe. I wash my hands every day, whether I am at work or not. I try not to touch my face, nose, or eyes. Also, when I'm not at work, it is important for me to stay safe at home and socially distance while in the community. Oscar is supported by Stephen Isaacson, employment training specialist, who has provided on-site and virtual supports by core foundations at Kennedy Krieger Institute. Next slide, please.
Next, we are highlighting Lamont Duke. Lamont Duke started working at Walmart in February 2020 before the pandemic. Lamont worked up until the beginning of April, then took off of work. At the end of May, Lamont returned back to work at Walmart. Lamont's job coaches and job developer, Twyla Bishop, worked with Lamont during COVID-19. They encouraged and uplifted him for doing a wonderful job. Lamont did not allow the pandemic to take away his joy and love for the job. Lamont has blossomed at his job tasks and continues to show his strengths. Despite his hearing impairment, it does not keep him from doing the job. Lamont has a great temperament, stays in character, and is consistent. Lamont helps the customers to the best of his ability. He never comes across anxious. Lamont practices social distancing and wears his mask while he is at work. He is respectful to companion staff and to the Walmart team. Companions is proud of Lamont Duke and looks forward to seeing him flourish in the near future. Next slide, please.
Next, we will highlight Karen Scott. Karen has continued her full-time employment at Mercy Hospital in downtown Baltimore during the pandemic without interruption. Karen's employment services during COVID-19 have been provided by her St. Peter's case manager, Chelsea Hunter. The relationship formed between Karen and Chelsea has addressed the discussion of COVID-19, ongoing check-ins, resolving transportation issues, schedule changes, and notice of days off. Karen's supervisor has appreciated the ongoing dialogue by with employee assistance from case managers to ensure regular and committed completion of work by Karen. Karen's positive attitude, persistence, and commitment to her job in the food service department with exceptional attendance has served as a model to all of her coworkers. And lastly, the partnership between Karen, employer, Mercy Hospital, and the agency, St. Peter's, have further exhibited that good communication, relationships, and collaboration can be achieved when all strive toward the goal of employment first. Next slide, please.
Next, I'd like to highlight Jonathan Sumner. Jonathan is currently working at Safeway. He's been working at Safeway during the pandemic. The title of his job at Safeway is being a courtesy clerk, which means he helps customers with their groceries. He will organize and clean trash and carts and do propane exchanges for customers. Jonathan has been working at Safeway for 2.5 years and before was volunteering at the Habitat for Humanity Restore. When Jonathan had volunteered, he would help with organizing and restocking furniture. Before being a volunteer, Jonathan participated in Project Search, where he did his internships like gardening, data entry, and at a car dealership. We are very proud of all the essential workers and thank them for their service during this time of the pandemic and always. And of course, everyone is very thankful to everyone, as Stacy mentioned, direct support professionals, providers, DDA, MDOD, and all the partners for all the work they've been doing during the pandemic and before. Next slide, please. So next, I'm excited to talk about the Association of People Supporting Employment First and where we are with the APSE chapter in the state of Maryland. Early this year, before the pandemic, a group of us actually reinstated the Maryland chapter after several years of there not being a chapter. That includes Amy Wallish from Full Circle, Tammy Goldsmith from People on the Go, Natalie Donner, ARC of Howard County, Neil Christopher, ARC of Chesapeake, and a few others that we're thrilled to be working on this as your board members. So what is the Association of People Supporting Employment First? It's a membership organization that's focused on improving employment outcomes for individuals with disabilities. We work with many of the agencies across the state, and we really appreciate all the support that we have received from DDA and MDOD as we've reinstated this chapter. We are really looking for your participation to get involved. Right now, all of our activities are open to anyone, and we're really hoping to grow the chapter so we can really focus on our Maryland chapter initiatives, which are, we want to be a national platform as a leader in employment first. We want to increase the collaboration across the state, which COVID-19 has really been useful for, where we've increased our collaboration, and we want to continue that. Policy impacts, strategic initiatives. We want to focus on training and education and continue that business outreach and collaboration to increase employment outcomes for individuals with disabilities. Next slide, please. So how can you get involved? Well, each month on the second Tuesday from 11:30 to 12:30, we have lunch with leaders. This is a collaborative call with professional leaders across the state of Maryland. We have DDA, MDOD, AUCD, Disability Rights Maryland, DOORS. We have the Governor's Workforce Development Board and many other organizations who are sharing information about disability policy, updates, what's coming next, and it's really helping to keep everyone informed. So you can register, which is linked here, and you can also contact me if you have any questions. Also, other upcoming events, December 3rd, we're hosting an APSE event that is open to all. We will focus on employment services in Maryland. We're hoping to have a panel of great guest speakers who are going to talk about Maryland and also the state of the employment on a national level through APSE. And then our next member meeting is January 19th. Also, this is open to everyone. You don't have to be a member. We are focusing on increasing our membership and wanting people to talk with us, learn about what we're doing, and then follow us on social. We're on LinkedIn, we're on Facebook, and then there is a coming soon Maryland APSE website and YouTube channel. So looking forward to increasing our presence in the state of Maryland, the collaboration in the state of Maryland, and how we can focus on policy changes to really support all in our community. Please reach out to me if you have any questions. Thank you. Next slide, please.
Thank you, Stacy, and a huge thank you for outlining the APSE Maryland chapter. I want to again echo Stacy's comments. If you are interested in all and learning more about what's happening around the state and around the country related to Employment First, I think getting connected to APSE is one of the best ways you can do that. Thank you to Kathleen and Stacy for highlighting those stories. You know, I want to acknowledge that there are many, many other stories out there. And as always, we invite stakeholders to share stories with us, whether it's this month or any time throughout the year, so that we can share those out on social media or in our monthly Employment First newsletter. And thank you to the people that do that. I love when I get something in my email that says, will you please share this story? So we're going to shift gears now and get into the topic of technology. I am pleased to introduce to you now Keith Walmsley, who is the Director of Public Policy Initiatives with the Maryland Developmental Disabilities Council. Keith?
Stacey, thank you. Hello, everybody. And I do indeed look as excited as I appear in that picture right now, even though you can't see me. Stacey, if I could have the next slide, that would be lovely. There we are. So I'm from the Maryland Developmental Disabilities Council. I'm sure most of you know about us, but if you don't, you can see on the screen that our mission is to advance the inclusion of people with developmental disabilities in all facets of community life by eliminating barriers, creating opportunities, empowering people, and promoting innovation. And in that spirit, we issue grant funding to lots of worthy organizations. And one of the grants that we worked on in employment is called the TIP grant, which is transforming and improving practices through customized technical assistance. That grant is in collaboration with Maryland Works, and it's a learning community that allows providers to contract with a subject matter expert and to receive technical assistance from the council to build capacity to improve employment outcomes. And the center of that work is a learning community. So that's a group of 7 providers that receive that grant, and they get to share their experiences and their practices together to help build best practices and to share knowledge and information. And it's really a conversational format, and throughout those conversations, as COVID began to bite, everybody necessarily reacted to it. And a lot of that reaction, of course, was confusion. There was a lot of confusion in the world, as we'll all remember, and the community helped to, the learning community helped to stabilize one another and to build some cohesion and a path forward to continue to provide employment services to the people with developmental disabilities that they serve. And during those conversations, Stacey, can I have the next slide, please? There we are. During those conversations, it became very, very clear to me and to the grantees that the major stumbling block, as we all kind of transitioned into this world, into a kind of Zoom-focused world, that access to technology was a real divide. And I think it's a divide that had already existed, and it was merely highlighted by the new normal. And so we talked a lot in the learning community about what would bridge that divide. And sometimes the simplest solutions are the best ones, and it was the case for us. So the council put together a grant. It's called Addressing the Technology Needs of People with Developmental Disabilities, and you can see some information about it on your screens. We put nearly $73,000 into iPads and internet hotspots, and those iPads and hotspots will be purchased by providers, and they will be passed out to people that they serve who will are most in need of that technology and who will benefit from it most. They in turn will report to the council, and we will use that information to hopefully increase the number of people who are receiving employment support a meaningful day. And really, hopefully, we will be able to inform broad system change efforts so that others can learn, other providers, other states, other systems can learn from our example. So that's all I have to say about that. I understand that Chip and his team from St. Peter's will be up next, and they were a grant recipient.
Thank you, Keith. I really appreciate the words. And my name's Chip Woods. I serve as the Executive Director at St. Peter's Adult Learning Center. And we've been committed to employment for a number of years. the program at St. Peter's opened in 1982, and we're located in Southwest Baltimore, in Baltimore City. And we serve, most of our folks are in the low to moderate income crowd. And what we've learned during this period, actually when we started, the operation was founded by a Sister of Mercy, Sister Catherine Newsline, and really her premise was get to know the folks, get to know, establish relationships, know the individuals by name. And that's one thing that we've strived to continue in our mission, is to serve the individuals, recognize their uniqueness, and that they can be contributing members of society. So, you know, the TIP grant, you know, kind of moved us a little further. Was really a great opportunity to receive that. And as Keith mentioned, it had some unintended consequences for us. And one of those consequences for us was that we really started to develop some relationships with the other recipients. When the grant started, it was actually at the end of 2019. What happened was we started to, you know, focus on strategic planning, and that was our goal at the time. You know, we wanted to revise our strategic plan to be more focused on employment outcomes, to focus on a feeder system through volunteer sites that would offer folks not only job skill development, but also interpersonal skill development, and then prepare them almost like internships for employment. And then COVID-19 hit. And we had a number of sites, both on the employment side and on the volunteer side, and COVID-19 hit, and it really took us for a loop. But what we found is that through this partnership, through not only through the DD Council, but also Maryland Works, which was also a co-partner, we started to develop these partnerships. And so one of the things that we did at the beginning of each of these meetings was to talk about, you know, how are we working through COVID-19? What are any suggestions that we may have? We started to really drill down, and as we started to move, develop our strategic planning, we also started to figure out we've got a new normal here, and the new normal is going to require some technology. You know, the first couple months of COVID-19, we thought, well, you know, we'll see how this goes. But then, you know, here we are now going into 7 months. We closed on the 17th of March. And as we got into that period of time, it started to come to the group, and through discussion was, you know, we think we really may need some additional support in forms of technology. And as I mentioned, St. Peter's is really a community-based, neighborhood-based, downtown-based agency. Most of our folks travel through by mobility, through MTA buses, light rail, to their jobs, to their volunteer placements, to Meaningful Day with staff. And what we found is that we really need some technology support. And so with the assistance of the folks at DD Council, Rachel London, Keith, and Brian Miller, along with Jay Stewart and Bob Hoffman at Maryland Works, we started to find out that, you know, first off, find out how much technology do we really need. And our staff went out and visited with our individuals virtually, started to find out they don't, through phone calls rather, and they found out that a lot of our folks do not have the equipment to even participate in virtual services. So we really started doing some internal brainstorming, and then met back with the DD Council and Maryland Works support team and put a bid in for the technology grant that Keith mentioned. We were fortunate to also receive that grant. And, you know, the solution really is, again, is being flexible, as Deputy Secretary Simons mentioned, partnerships, you know, learning the needs of our members, not just assuming that we know the needs of our members. And really going back to our core value, which is relationships. The iPads that were in the technology grant, along with hotspots, that was the other piece to it, is that we found that a number of our members did not have the internet service to be able to participate. So not only was the grant for iPads, they were also for the technology through the internet. The iPads will help us to kind of, you know, access employment, we believe, through fact checking. It will also help us with application submissions, research of employment, and also notifications to our folks. It won't just be verbal. And oftentimes that's what we've found through the employment searches that we've conducted and has led to employment for our folks. Same as with Corinne Scott today that was mentioned earlier, or highlighted with the other recipients. Her highlighted work rather to get toward employment was through the internet. So I'm going to introduce Chelsea Hunter, who is a case manager who worked with Corinne, and then she's going to also introduce Brittany Ammons, who is a job coach instructor, and what she's doing with our virtual services. Chelsea.
Hello, can everyone hear me?
Yes, we can.
Okay, cool. So yeah, I am a case manager at St. Peter's, and I did work with Corinne. Before COVID, I would actually go visit her at her job site. Now that it's not necessarily the safest idea to be going around doing in-person visits, we do have to rely on technology to keep in contact with our individuals. So as it was said in her highlight, I just make sure that everything with Corinne is going well, and we do so virtually, like over the phone. She'll let me know if she has any issues, even if she's just feeling stressed about something. Just being able to call me and talk it through and like help her feel relaxed goes a long way. Sometimes I'll follow up with her supervisor just to make sure that everything is going well and that the issue's actually resolved. So now we're just trying to focus on making sure all the other individuals can get back to their activities virtually, and Brittany can explain how we're doing that.
Hello? Hello, can everyone hear me?
We can hear you.
Yes.
Oh, yes. Hi, everyone. My name is Brittany Amos. I'm a job coach instructor at St. Peter's. Like Chelsea and Chip said, our virtual service program is going pretty well. We got familiar with using technology every day, using Zoom. We have classes Monday through Friday, 3 to 4 sessions each day. Each class is an hour long. We work on life skills, social skills, employment skills. We partner with Baltimore Recs and Parks. So some of our clients get to join the yoga class, music class, and arts and crafts. So each week our goal is to add more clients to our classes. Thank you.
Thanks. Thank you, Brittany. And we really appreciate the leadership by Secretary Beatty, Deputy Secretary Simons, and Stacy. Thank you for orchestrating this with your team for National Disability Employment Awareness Month. We really missed it this month because, or rather this year because of COVID, but annually we celebrate it during the month of October with a series of events and speakers, and it's been a great celebration. So we really appreciate the fact that DDA has continued this series for the Awareness Month for employment, and we look forward to moving forward with our virtual services and really gaining on employment outcomes as we move forward. Thank you so much. Keith, our next slide, please.
Thank you. Thank you so much, Chip. And thank you to Chelsea and Brittany for sharing all the stories. It's really wonderful to hear not only, something that Chip, that you said that I really thought about is you didn't just take for granted that you knew what people wanted. You really took the time to figure out what were the needs so that you could better address them. And that partnership really helped take things to the next level. And thank you to Keith from the DD Council for outlining a little bit about that initiative. We appreciate it. Before we go into the next portion of our presentation, I just want to give people an opportunity to stand up, stretch, take a breath, maybe get some coffee. I think a lot of us are spending an awful lot of time in front of screens lately, whether it's your tablet or your phone or computers. And we know that it is very critical for both your physical and mental health to remember to get up and move on a regular basis. So we want to encourage that right now. So it's 10:40 right now, and we're gonna take a 4-minute stretch break and start back up at 10:45. So if you need to move around, please do so. And I'll get us started on our next speaker at 10:45. Okay, everybody, it's 10:45. I hope that everybody actually used the opportunity to take a break. There's no way to prove it. But again, I just think we all are spending a lot of time sitting down, looking at screens. It's great to look away and get a refresher on your coffee. So we're going to move on with our presentation. And I am very pleased to have with us this morning a huge partner in Maryland in our Employment First initiative, Jade Gingrich, who is the Director of Employment Policy at the Maryland Department of Disability. Jade, take it away.
Great. Thank you, Stacy. And thank you all for your tremendous efforts in supporting essential workers, in working with individuals to identify their needs and their interests, to place them into employment, and eliminating subminimum wage. So Maryland is certainly a national leader because of your dedication, and your work is appreciated. Next slide, Stacy. So data is critical in our Employment First initiative, and we actually early on had a number of discussions about the fact that we didn't really have the data that we needed to be able to even tell how we were doing. And so, you know, the data that we began collecting, and thank you all for your assistance in starting to collect that, at least gave us some snapshots of where we were, as well as where we are. And it really helps us to highlight the progress that we've made, as well as helping us to make informed decisions and gets us focused on desired results. You know, if we don't count it, we find that oftentimes it's difficult to focus on it. So having that data is important. And, you know, we don't just use the data to penalize, but rather to identify who needs additional help and support. How can we help those entities that maybe are struggling a little bit with achieving these outcomes and employment and so forth, as well as the ability for us to lift up what we're doing well. And there are so many places, even in spite of COVID, where we are doing well. Certainly at a national level, things are changing, and it's helpful to try and understand what's happening nationally to be able to inform our work here at the state level. So with that, next slide, please. I'm really, really pleased to introduce Andrew Houghtonville. He is a nationally recognized disability data expert. And if you've had the opportunity to sit on the Untitled presentations monthly that cover policy as well as data, you know the wealth of knowledge and insight he brings. So with that, I'd like to turn it over to Andrew. Thank you so much for being with us today.
You're welcome. Thank you for having me. Can you hear me okay? Mm-hmm. Okay, good. All right. So I'm going to provide some statistics at the national level, and certainly there are statistics available at the Maryland level. I almost said Maine. That's nearby New Hampshire. At the Maryland level, and also with regard to specific disability types. It is a bit hard to get month-to-month statistics at that granular level. We're working on that because month-to-month statistics have become more and more important with COVID. So can you go back to the last slide? It might be on a timer. Not quite sure why. So what you see in front of you is the month-to-month statistics going back to the beginning of the Great Recession. That's when the U.S. Department of Labor Statistics, the Bureau of Labor Statistics, started collecting data on the population with disabilities. That's how long it took. It took at least 10 years, actually, just of advocating to get the questions asked in the surveys that are used to create the official employment statistics. And so these are the trends. And so what you're seeing here is basically the Great Recession and the very slow, long, protracted recovery from the Great Recession. And you can see that the top line for people without disabilities, it really took quite a number of years to get back to the level. It wasn't really till 2017 that people without disabilities got back to the level previously seen before before the Great Recession. For people with disabilities, it's a bit of a different story, right? So for people with disabilities, you see this protracted decline. The decline goes all the way, you know, with some blips down in 2013 and 14, even till 2016, it's kind of flat. If you take out that deep dive at the end of 2013. And so it really wasn't until around 2017 that we start seeing an increase for the employment of people with disabilities broadly. And this is ages 16 to 64, because we don't want to, with the aging of the baby boom, that's going to really change the dynamic of disability itself for the entire population. So we primarily stick to age 16 to 64, and that's also what the government does as well when they provide statistics. But really what you're seeing is this rise, and I'll tell you, this was a very exciting time when we started seeing this rise. This is the first rise and closing. You actually see, I'm pointing to my screen, but you actually see a closing. It's kind of, you kind of have to squint your eyes, but you can see kind of a narrowing of the gap between people with and without disabilities. That was one of the first times we'd ever seen it in any data. And I have data, the earliest data I have is going back to the early 1970s. And so this was really exciting. And then of course it starts to kind of wane towards 2008, 2009, and into 2020, 2018, 19, and then it's 20. And then we start to see the COVID. So in people with disabilities, these data are for the early part of March, and so COVID really hadn't hit, the vast majority of the country in the first 2 weeks. We didn't see any shutdowns at that point, but you do see some softness, some decline for people without disabilities. People with disabilities, you actually saw an increase in March. Why don't we go to the next slide? So here comes April. So April takes a huge dive, right? So for both people with and without disabilities, it declines substantially. One thing to note is that for people with disabilities, it actually didn't go below the 2013, 14 marks. And that's either good, because it suggests that people with disabilities are in jobs, workers with disabilities are in jobs that were not as impacted by the COVID recession, or it's a little bit worse, where, go back a little bit, go back one slide, or it's a little bit worse where it was really bad in 2013 and 14. So people with disabilities have seen quite a remarkable decline. If you look at the depth of the decline after the Great Recession, people with disabilities declined nearly twice as much as people without disabilities. So anyway, next slide. So we see May. Oops, go forward to May. We see this jump, right? And so we see a bit of a recovery. So people who were on furlough, if you're on furlough, you're actually considered unemployed. So this statistic is actually the percentage of people who are employed. And so people on temporary furlough, even if it was temporary and you're expected to be recalled, you were actually considered unemployed by the Bureau of Labor Statistics. Go to the next slide. June, we see a nice big jump for people without disabilities, but people with disabilities kind of slow. Next slide. July, August, you see so a continuing rise, a little bit of a stagger for people with disabilities. Next slide, into September. Do I have September in this slide, Joe? So September, we start seeing things taper off. And so this is early September. Some of the southern states and western states were still experiencing their second peak or their first big peak at that point in time. And this is something that is of big concern if we're seeing a slowdown in this kind of recovery from the shutdown periods, right? We're still not back to the level we were in March. And it's a real big concern that the longer this lasts, people who were on temporary furlough are now on permanent termination, right? The companies are shutting down, they're changing their jobs, they're permanently laying people off, as opposed to the ability to be recalled. Let's go to the next slide. So I want to show you kind of a bellwether statistic, the labor force participation rate. So this is a statistic that's very similar to what you saw before, but it also adds in people who are actively looking for work, right? So it's a measure of how engaged people are in the labor market. So you're either working or you're actively looking for work, and within the last 4 weeks. And so why don't we go to the next slide, the post-COVID. So that's March. And if we go to the next slide, we see the COVID months. And so this, for me, was a really good sign for people with disabilities. Unlike people without disabilities who saw a big decline and then a substantial jump up, for me, this meant that people with disabilities were either staying in, remaining employed. We saw that went down, but they're also staying engaged, right? They're either on temporary layoff or they're actively looking for work. And so this is actually the statistic that I personally am most concerned about, because if you leave the labor force, if you stop looking for work, if you're not on temporary furlough, this number will go down. And this is the statistic that I think a lot of people in vocational rehabilitation services and employment services in general are really striving to maintain. So help people maintain connection with their current employers, such that they could be recalled if the firm reopens, if the company reopens, or basically staying engaged, looking for work, continuing to work with employment services as a way of staying actively engaged. If this number starts going down, it could take a lot longer for people with disabilities to recover from COVID, from the COVID economy. How am I doing on time?
You're doing great.
All right, I want to just provide a couple more slides. Go to the next slide. We're not going to do a line chart now. We're going to do a bar chart. So we're going to look at people with and without disabilities, but we're going to look at the number employed. The number unemployed, so the number who are actively looking for work or on temporary layoff, hoping to be, with the idea that they're going to be recalled. So next slide. So here are people with disabilities. And so we see the 2019 average was about 5 million. I'm sorry, this is without disabilities, sorry. That was a big number. So about 5 million were unemployed. It jumps up 4 times as much to 20 million during the shutdown periods in April. And then as of August, we were at, I don't know why I don't have September in here. Oh, September, I haven't calculated those numbers yet. But around 12 million. For people without disabilities, next slide, we see, oops, my screen is, I'm covering my control panel. We see about 400,000 not working, not employed. I'm sorry, not employed, not looking for, unemployed. People who are looking for work or on furlough, that jumps up, almost doubles, more than doubles, and then it slowly declined. Now, this is what we would expect. So people are going back to work. For people without disabilities, they're not leaving the labor market, so they're still engaged in the process. However, among these people, things are changing. So I'm going to divide this chart. I'm going to divide this chart by the percent that are looking for work versus the ones that are on temporary layoff, meaning they're going to be recalled. So go ahead and go to the next slide. So this is people without disabilities. We see that at the very beginning, most people, 79%, were on temporary layoff, right? However, while this number has declined, that percentage has declined, right? So if you look in August, 55% are actively looking for work. They're terminated. They no longer have their job. 40%, 45% still have a job and are hoping to be recalled. Let's go to the next slide. So we're going to put over this for people with disabilities. And the story is a bit different. So at the beginning, it's about the same. 73% of the April unemployed were expecting to be recalled at some point in the future. but now it's only 33%, right? So about 1/3 in August, and I'm really looking to see what this is going to show in September. 33% were expecting to be recalled. 67% are looking for new work, right? And so while unemployment has declined, let's go back up. While unemployment has declined, the size of the unemployed population, it's becoming kind of more concentrated in people who no longer have connection with their prior employer. And so keeping that connection with the prior employer during this time and during the Great Recession as well, previously in any economic downturn, maintaining the connection with your prior employer through, you're not at work for no lack of, for no fault of your own, it's a big recession or it's a pandemic, maintaining that connection is the key. And I am concerned about the future, that the people who aren't recalled by their prior employer will have a lot of difficulty finding work and getting back into a new workplace. I'll stop there and go ahead and go to the next slide. I think that's for the next speaker.
Thank you, Andrew. That was very helpful. It gives us a national perspective before we talk a little bit about Maryland. And I'm just going to ask if people have questions, related to the data. You're welcome to type into the chat box, and we can, towards the end of the presentation, circle back on those.
Yeah, and I can answer them if I'm able to. I can answer them in the chat box as we go.
Excellent. Thank you so much. So I'm going to bring us back to Maryland and talk more specifically about what kinds of data we do track here in the state and what it is telling us. So first, as a general reminder, because there might be new people joining us, I'm going to tell you a little bit about what data DDA tracks related to employment outcomes. Some of this might be review to you, but again, I want to make sure that for those of you that are new, that you're hearing this. So since 2014, all DDA providers of meaningful day services, so that means day habilitation, community development services, or our employment services, have submitted employment outcome data to the DDA twice a year. And that data is public, and you can find it at the link that's on our screen. You can sort it. You can look at various reports on the data, that whether it's by region or by county or by provider. We track things like, are people working? If they're working, what kind of employment are they engaged in? What are the hours that people are working? What are their wages? And do they have access to benefits in their employment? We also track things like non-work activities and how often they are occurring, and whether they happen in the community or in more facility-based settings. So we know that prior to COVID, Maryland had seen an upward trajectory of people receiving, people that were competitively employed, and that actually fits the national data that Andrew shared. So our typical data collection would have occurred in May of this year. However, obviously due to COVID, we knew that it wasn't going to be feasible to do our typical tracking. And instead, we really developed a much shorter modified survey that was sent to provider agencies that asked for more aggregate level data as opposed to individual level data about each person that they supported, so that we could have some information about whether people were still working and generally what kind of effect was COVID having on employment during that period of time. So just to give you a sense of the data, the survey was sent to 114 DDA providers, and out of that number, 72 of those providers responded. And I'm going to share with you some of the data that we collected. So our survey went out in June. So this data is actually from both June or July, depending on when the provider submitted the data. The first thing that we wanted to know was, of people that had been employed prior to COVID, and for this survey, we said that March 1st, 2020 would be considered pre-COVID. So people that had been working or employed in March of this year, what was the current status of those people? And you can see by looking at the blue bars, we found that 48% of people that were employed pre-COVID were working their typical hours in the months of June and July. 5% were working reduced hours, 27% were furloughed, 6% were laid off, and 18% were voluntarily not working due to concerns that they had, maybe due to safety, about COVID. And we also tracked the same data for people that whose employment is through individual contracted jobs or group supported jobs. So you can see what those numbers look like in June and July of this year. So we also wanted to know, what do those numbers look like if we compare them to other states that were tracking similar things? So our data was compared with the data from 7 other state employment leadership network states, or SELN. And you can see again in blue represents people receiving DDA services in Maryland, that in the other 7 states we were compared with, more people were working during that June and July period than in the other 7 states where the data was compared. You can see that slightly less people were furloughed in Maryland, less people were laid off, and slightly more people were voluntarily not working during that same period of time. So we know that there are a lot of unknowns about this data. We know it's not fully complete, but we think it gave us a reasonable and an important snapshot in time during that critical period. What we want to continue looking at is our individual level data tracking, which actually resumes this month in October. But in order to really better understand the impact of COVID, we have added a few additional questions to our typical data tracking. And the first thing that we want to know is, if a person is not currently working in October, was it directly due to COVID? And if so, why? So meaning, was the person laid off? Was the person terminated? Did the person quit? Or is it some other reason? And then we also want to know how the person is being supported in those outcomes. Did they get support via remote supports? Did they get in-person supports? Or did they get a combination of both remote and in-person supports? And just a quick thought on the remote versus in-person supports. As many people this morning have commented, the use of remote supports has been critical during this period of time. But the other piece of feedback that we've continually gotten is people want to continue to receive remote supports and remote services. So this will give us, again, another meaningful baseline of how frequently are people getting those type of supports now. The information is really going to give us a baseline when looking at COVID's impact and how people are being supported across the state. And as we collect that data, as always, we will share it with stakeholders. I anticipate that will probably be available sometime in December of this year. And just like all of our other data, it will be uploaded to the public site. And we'll make sure to outline anything that we find. Because again, as everyone that's talked about data has mentioned, it really better informs our decisions and tells us what we need to do moving forward. So we're paying very close attention to the situation. So I am really thrilled today. Actually, I'm going to pass things over to Jade, if that's okay.
Yes, that's fine. Thank you, Stacy. And thank you both to Andrew and Stacy for that really interesting data. And it gives me hope that the work that we're doing hasn't been in vain, and that we are continuing to make inroads around employment. And now it's time to really celebrate why Maryland is a national leader. And I'm happy to introduce Matt Rice, who was part of the leadership advocacy effort along with Ken Capone and Tammy Goldsmith, amongst other partners, who led the effort to get legislation passed to eliminate subminimum wage in Maryland. And of course, we've passed that threshold this month, and that's something to celebrate. So with that, I will turn it over to Matt and Tammy. Thank you for your leadership.
Well, thank you for that introduction, Jade. It's certainly a privilege to be here to celebrate National Disability Employment Awareness Month. I am Matt Rice. I am the Public Policy Specialist for People on the Go of Maryland. We are the statewide self-advocacy organization for those with intellectual and/or developmental disabilities. Today, unfortunately, Ken could not be with us, which is really a shame. But I have the privilege of working with my colleague, Tammy Goldsmith from People on the Go, to talk about the phase out of subminimum wage.
Thank you, Matt. Yes, so I am the program coordinator for People on the Go of Maryland, and I did speak with Ken yesterday. He's just not feeling very well over the last couple of days and sends his regards, and he apologized for not being able to be with us today. Next slide, please. So Matt and I today are going to talk a little bit about the passing of the Ken Capone Equal Employment Act, which was signed in May of 2016. This picture just gives you an idea of how many partnerships, collaborations, and how many people around the state that came together to make this historical event possible. And we thank Governor Larry Hogan for signing this bill into law. We were really proud that as a partnership that we were able to get this bill passed in the first year of its legislation. And so as Matt said, you know, People on the Go is we are a grassroots organization. We've been in existence for 31 years. We are proud to represent the state of Maryland as a self-advocacy organization. Next slide, please.
Okay, so that leads me to talking about 14C and the Fair Labor Standards Act. So for those of you who may not be aware, I imagine most of you probably are, Section 14C is a section under the Fair Labor Standards Act, which was passed into law in 1938 as part of President Franklin Roosevelt's New Deal legislation. The intent of Section 14C was to allow for the payment of subminimum wage so that people with disabilities, especially wounded veterans, and other people with disabilities could gain meaningful work experience. It was never intended to be a permanent job placement. So how does Section 14C work? Well, in Maryland, the provider of service would obtain a federal 14C certificate from the U.S. Department of Labor, and they would do this by conducting a time study which measures the workers' rate of productivity against that of someone without a disability, and if the worker with a disability was less than 50% productive, they could be paid subminimum wage. Next slide, please. So I went over.
No, that's good. Thanks, Matt. So economic barriers to this, if a person makes less than minimum wage, they don't have opportunities for economic self-sufficiency. The studies and personal accounts have proven that individuals with disabilities who are in the workforce are better included in other social activities and things around things that they want to do within their life. Poverty is a problem across the country, but it is more so even with people with disabilities. We know that people are more isolated than others. COVID has really even hit that community even harder. But we strive for economic growth and full inclusion for individuals with disabilities. Next slide, please. So we just wanted to go over a little bit of how we defined the problem in Maryland. When we started down this road, we realized that in Maryland, we talked to our members, we talked to providers, and we went around to see what was, what people were thinking about sub-minimum wage and sheltered work as well. So some individuals with disabilities we found were being paid little as pennies on the dollar. So Matt talked a little bit about the time study. And so that time study was showing a person's productivity. So they weren't making much money based on what the time study showed for a person without a disability. We saw a study that was done in 2001 that was by the United States Government of Accounting Office, showed that 5% of people in 14C placement transitioned to community-based jobs. And that sub-minimum wages, we really feel is unfair and a discriminatory practice. And employees without disabilities don't have their pay measured by this productivity scale. Next slide, please. Matt?
So the bill highlights and outcomes of the Equal Employment Act. As of October 2016, no provider could obtain a new federal 14C certificate. And October of 2017 required DDA and the Maryland Department of Disabilities to begin looking at the transition process away from 14C. And of course, we did that with a variety of stakeholders. I really want to thank Lizzie Hall from the Maryland Department of Disabilities, and of course, Stacy Jones of the Developmental Disabilities Administration for their collaboration, and everybody who helped facilitate the planning that took place over the last 4 years to make this a reality. The other highlight that I think is the most important part of the Equal Employment Act is the focus on the individual planning. So everybody who receives DDA services has that individual or person-centered plan. And when we were looking at how to do the transition away from 14C, we really wanted to focus on addressing those barriers within the person-centered plan to employment, and making sure that they would be addressed. Next slide, please.
Yeah. Thanks, Matt. So we just wanted to show you a little bit of statistics, give you a snapshot of where we were as of October of 2016. So you can see on this chart that 5.7 million people in the United States at the time and 7.3% are under the age of 65 and identified as a person with a disability was 416,000. The number of providers within the state of Maryland that held 14C certificates was 41. And the number of individuals that are under DDA services that were working under 14C at the time were 2,400. Next slide, please. So now we fast forward to 2019 and the sunsetting of this bill. We had 6 million people living in the United States, and under that 7.3% under the age of 60, or 7.3 million under the, I'm sorry, 7.3% under the age of 65 identified as a person with a disability, or 438,000. Now, and as of then, number of providers with 14C certificates was 4. And data over the past 3 years has shown an increase of the percentage. So you can see that in October of 2017, it was 20.1%. And then in May of 2019, it jumped to 22.2. So you can see a slight incline there. Next slide, please.
Okay. So as of October of this year, I am pleased to say that we have completed the transition, and nobody with a developmental disability is being paid sub-minimum wage. I should note, because I kind of skipped over it earlier on, that there is the ability under what is known as the McNamara-O'Hara Service Contracts Act and the Walsh-Healy Public Contracts Act to pay wages under a 14C certificate which are less than the prevailing wage. So we're talking about federal or state contracts, and people under those contracts are being paid at least the minimum wage, but perhaps less than the wage that a non-disabled worker would get for doing similar type of work under that contract. So I just wanted to go back and clean up my faux pas a little bit. And finally, you have our contact info on the slide. So if anyone has any questions about the Equal Employment Act or about people on the go in general, we are here to serve. And last but not least, I would be remiss in my duties as a public policy specialist if I did not encourage you all to exercise your most fundamental right. And if you have not done so, please vote.
Thank you.
Thank you, Matt, and thank you, Tammy, for that overview. And also a huge thank you to Ken Capone. And we're sorry he couldn't join us, but we also want to thank him for his leadership around this initiative and on the phase out. And I just want to add another comment about data as it relates to this. So each year as this phase out has unfolded, we have submitted, as was referenced, a legislative report that provides data related to the phase out. And as I alluded to earlier, because of COVID, we don't have the same data points that we typically would have. So the 2020 Equal Employment Act legislative report doesn't have those final data points. However, as a state and as a state leadership team around Employment First, we remain dedicated to tracking that data. And as Matt alluded to, for people that receive DDA funded supports, we have really infused some of that tracking directly into the person-centered plan by making sure that all people that are of working age whether or not they ever worked under a 14C certificate, have the opportunity to identify directly in their plan what are the barriers to employment so that those can be tracked over time. And not only are we able to track that at the individual level, so what is the person that I'm supporting, what are the barriers and how can we support that person, but we can also take a look at the barriers across our system to see what are the areas that might need further support, what are the trends that we're seeing, and so those are pieces of this collaboration that will continue to move on even though we've closed out this chapter in the phase out. So thank you again for your work, and thank you for being part of this webinar today. We appreciate that.
Thank you, Stacy.
So let me just stop and say that really 2020, I think it goes without saying, but I will say it, has been a year with really unprecedented challenges. But I can say that people have risen to the challenge and have helped to keep things moving in new ways around Employment First. It's been pretty amazing to see. As we look ahead at the future of Employment First, whether it's here in Maryland or nationally, there are things that are emerging that I think will eventually become that roadmap that moves us forward. So first and foremost, we want to continue to leverage the opportunities that have come along with the public health emergency. So while it has been a difficult time, we want to recognize what those opportunities are. And they've been mentioned several times today. Things like service flexibilities, those really critical partnerships and collaborations, which you heard all about during the presentations, those things have been absolutely necessary in helping to keep people safe and healthy, and beyond that, to keep people connected to their communities, to their families, and keep people connected to their employers or to continue to be engaged in job searches. So we know that the use of technology and remote supports, again, has been critical. We wouldn't be able to do this today without it. And we are hearing loud and clear that people would like to continue to have those kind of options moving forward. We also know that provider organizations are rethinking their support models and continuing to reduce their reliance on congregate settings. And a lot of that had already been happening, but this public health emergency really pushed that initiative even further. And finally, the goal remains the same, that through it all, we want to continue to increase quality employment outcomes for people with disabilities in Maryland. And we know that how we accomplish that may look different through time, and we know that the data points may change, but we stand equally committed to that initiative and to that focus area in Maryland. We have really engaged partners all across the state. We've heard from a lot of them today. We couldn't do this without all of you. So I just want to say a personal thank you, and on behalf of DDA, for being as engaged as you are around employment in Maryland. It's a great state to be in when we talk about employment. So thank you. And as we wrap up today, again, I want to thank every one of our panelists that took the time out of their day to be part of this webinar. I know I'm not the only person that really misses our in-person summit, where we would come together for a full day and be able to spend time and network and see each other. But we really thought it was important to still stay connected today and do something so that people see all of the great things that are happening. So we ask that you continue to stay in touch by signing up to be on our mailing lists. You will see the links are here right on when you download the presentation. You can click right on those links, or you can go to the DDA website. We have our training and webinar calendar so you can keep your eye out for any additional upcoming webinars. And you can also take a look at all of our cataloged Employment First newsletters. So I would say a lot of the things that we've talked about today, you will find in previous newsletters. If you need background on the Equal Employment Act, background on our data initiative, or any of the other things that we talked about. And finally, if you have success stories that you would like to share, or you have questions about today's presentation, you can feel free to email me at stacy.jones@maryland.gov. And that concludes today's webinar. And we want to thank you all for participating. And I hope everybody has a wonderful weekend. Thank you.